Welcome to my YouTube channel. Our today's topic for discussion is medicines which are used commonly, and also known as over-the-counter medications. In today's topic, we will discuss medication, classification, indications, doses, contraindications, and their mechanism of action. Our first medicine is acetylsalicylic acid, also known as aspirin. Dose 160 to 325 milligrams orally. Classification: nonsteroidal anti-inflammatory drug or platelet aggregation inhibitor. Indications: acute coronary syndrome. Aspirin is also used to limit further clotting during an acute myocardial infarction. It is one of the only medications to show higher outcomes when used. Contraindications: 1. Gastrointestinal bleeding. 2. Asthmatics sensitive to acetylsalicylic acid. 3. Hypersensitivity. Mechanism of action: irreversibly inhibit cyclooxygenase 1-COX1, which blocks thromboxane A2. It will blocks platelet aggregation sticking to stop clots from growing larger. Our second medicine is salbutamol, also known as Ventolin. Dose: metered dose inhaler 100 micrograms for spray 5 to 10 sprays. For nebulization, recommended dose is 2.5 to 5 milligrams. Classification: bronchodilator, sympathomimetic B2 agonist. Indications: bronchoconstriction, wheezes with shortness of breath. Salbutamol is used to relieve bronchoconstriction in an asthmatic or COPD patients. Mechanism of action: it is a short-acting beta to adrenergic receptor agonist, which works by causing relaxation of airway smooth muscles. Contraindications for salbutamol: 1. Hypersensitivity. 2. Ischemic chest pain. Our third medicine is Ipratropium Bromide, also known as Atrovent. Dose: for metered dose inhaler 20 micrograms for spray 1 to 5 sprays. For nebulization, recommended dose is 150 to 500 micrograms. Classification: anticholinergic. Indications: bronchoconstriction, wheezes. With shortness of breath, Ipratropium Bromide is used to bronchodilator and reduce bronchoil secretions in an asthmatic or COPD patient. Mechanism of action: Ipratropium Bromide decreases bronchial secretions by binding to cholinergic receptors and stopping fluid shift into bronchioles. Contraindications: 1. Hypersensitivity. 2. Ischemic chest pain. Our fourth medicine is epinephrine, also known as adrenaline. Dose: 0.3 milligrams intramuscular. Classification: sympathomimetic. Indications: anaphylaxis, near-death asthma. Epinephrine stimulates the alpha-1, which causes vasoconstriction. It also stimulates beta-1, which is responsible for contractility and heart rate. It also stimulates beta-2, which cause bronchodilation. Contraindications: hypersensitivity. Our fifth medicine is Glucagon. Dose for adults: 1 milligram. Classification: anti-hypoglycemia, also known as pancreatic hormone. Indications: used in hypoglycemia when patient is unconscious and unable to initiate by intravenous route. Mechanism of action: it stimulates release of glycogen from the liver for increase in blood glucose. Contraindications: 1. Hypersensitivity. 2. Pheochromocytoma. Our sixth medicine is 50% dextrose in water solution D5OW and 25% dextrose in water solution D5W. Dose: 25 grams slow IV push or 0.5 to 1 gram per kilogram, max 25 grams. Classification: carbohydrate. Indications: hypoglycemia. Mechanism of action: introducing D5OW will rapidly increase blood glucose levels. Contraindications: hyperglycemia. Our seventh and last medicine is Naloxone, also known as Narcan. Dose 0.4 to 2.0 milligrams every 2 to 3 minutes as required subcutaneous route or intramuscular or IN or IV route. Classification: opiate antagonist. Indications: decreased altered level of consciousness and respiratory depression in suspected opioid. Overdoes: mechanism of action: Narcan competes for opiate receptors. Because of its strong affinity, forces the opiate narcotic to dissociate. Contraindications: allergy or known sensitivity.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.